years old female. No any past history of like medical treatment in Thammasat hospital. But she said she has underlying of diabetes, and the chief complaint was fall. 7-hour PTA. So 7-hour PTA, she was like slip over and fall again on his back, and also the left hip was hit to the wall, and also
How many days?
7 hours.
7 hours
before, like, prior to the hospital.
Okay.
So she said that she can walk.
Okay, stop. Next. Sompat, come here. Stay here. So from the examination, tell me, what do you see? Yeah, external rotated. Okay, you know that.
How do I know it's external
Yeah.
rotated? The is here and
This look external rotated, and how can you say it's shortening?
I see that the zone of thought is this side is over here, the other side is
Yeah, it's shorter, right? But when you want to see by looking, you make sure that the patient is in good alignment, right? If the patient is not like in good alignment, not parallel to the bed, sometimes you can misinterpret. Okay? So this patient is lying in the center of the bed. Okay? So, what do you think from her age and these clinical pictures? Obvious shortening. Louder.
fracture of the hip
Fracture of the hip.
from the history and the physical examination. But maybe it's like because there's obvious shortening, maybe it's all into the intertrochanteric fracture because there's more like shortening.
Yeah. More shortening, also the in her age. She's 68, right? Comparing to that one is 61.
She's
Yeah.
86.
86. Okay. And the ecchymosis, sometimes if the patient come very early, you didn't see the ecchymosis. Okay, like you need to have like 3-4 days. But if the patient come early, you see nothing. And also the swelling around the hip joint. ป้าหมอดูหน่อยนะคะ You cannot see the obvious ecchymosis or swelling. Yeah. So we need X-ray. What we will request for X-ray. So stay here. That is the Shendon line. Some disruption here. You see this big piece of bone. What is that? Lesser trochanter. You see fracture line, obviously. Yeah. You see, this is good or not? This says some angulation, right? This is angulate. This is valgus or valgus angulations. Valgus. Okay, you see that. Neck sharp angle will decrease, that means it's valgus. It's like this. Okay, if the neck sharp is like this, this is valgus. So if you have valgus, this tend to have more shortening. Okay. So the fracture line extends from greater trochanter to lesser trochanter. Whenever you see the lesser trochanter fracture, this is not neck fracture, it's a trochanteric fracture. And sometimes the fracture is like interposition, you need traction force. Sometimes the patient came to see you with severe shortening. I recommend you to do the traction view, so you can see the fracture better. And most of the time, the patient came to see you with external rotations. You cannot see the fracture very well. You need to do traction and internal rotation, and you can see it better. So this is the intertrochanteric fracture with the big piece of bone, right? So we classify the intertrochanteric fracture into only 2 types, right? The first type is the event 1. Event 1, the fracture line extends from greater to lesser, this line. Another type 2 is a fracture line extend this way. Yeah? Reverse, we call reverse oblique. Reverse oblique. This is very unstable. So, what's your plan? How about the list of avascular necrosis one?
This case would have less lower risk of avascular necrosis compared to the
Yeah.
previous case.
Right? You have less chance of avascular necrosis because this is extra articular, the vascular supply already to the neck, So the vascular is there, so you have no chance of avascular necrosis. Okay? So this patient, arthroplasty or fixation? Huh? Fixation. Okay? Understand? So this patient we need to do fixation, and nowadays the fixation is very minimally invasive. You just make a small hole, put the nail in, and then fix it. Okay? So this is a way of fixation. Okay? So the plan is to do fixation. So go to another case.